Hi, Kevin from Darby Training Systems. Today we're going to be talking about exercise technique, specifically the split squat. The split squat is an excellent regression for those who struggle with the bilateral squat. Many people who struggle with the bilateral squat, it's an issue of ankle and hip mobility, both of which are key components of the split squat exercise. So let's talk about the technique. So for the split squat exercise, the first progression is the front foot elevated. Key thing here for cueing, center of pressure on the front foot, brace the core, and you're going to cue the person to drop into a squat position. The most common mistake that people make here is they're too focused on driving the knee forward. Remember, it's still a squat. So you drop down into the traditional squat and the knee moves where it should. Key things, the heel or center of pressure is maintained on the front foot, and you try, if you want to increase more challenge to hip mobility, you can try and straighten the back leg and keep the torso more upright. If that's not your challenge, you can allow a slight bend in the back leg and the torso can move forward, maintaining a neutral spine. It depends on your goal. This position, much more hip mobility is required. This position, more load can be used. The second progression for this exercise is the front foot flat. Again, it is a split squat, so center of pressure on the foot, brace the core, and you're dropping down into a traditional squat movement. If you want to emphasize hip mobility, you can straighten that back leg and keep the torso more upright. And if you're not emphasizing hip mobility, you can allow a slight bend in the back leg and a natural angle of the torso. So those are two variations of the split squat exercise. Remember, it's an excellent regression for those who struggle with the bilateral squat pattern because it focuses on hip and ankle mobility. Remember, mobile to move, stable to train.